guys, Dr. Andy here. Today I just want to do a very brief introduction in the difference between thoracic outlet syndrome and a pinched nerve coming from the neck, okay? So this is really common. We get patients in the office all of the time with symptoms that travel from the neck down into the arms, okay? So thoracic outlet syndrome is actually when the nerve is not being truly pinched by, let's say, like a disc herniation or a spur, something in the neck. It's actually getting kind of crunched because there's not enough space. And the good news is that's an easy one to fix, okay? Whereas a pinched nerve coming from the neck is a lot harder to fix. So obviously that is something that we want to differentiate. When you're here in the first time in the office, we want to make sure, do you have a true pinched nerve or do you have thoracic outlet syndrome? Because that will 100% determine a lot of our treatment that we do here in the office, okay? So this one is actually kind of simple, okay? I want you to start to think about the difference is in terms of your positioning, okay? So with thoracic outlet syndrome, what's going on is you might get symptoms coming from the neck down into the arm. It is all about, does the nerve have enough freedom? Okay, so the nerves come out of the neck right here in the front. It's a little different because most of the nerves come out of the back of your body, except for the neck. It's right here in front. They travel right through here into the brachial plexus, which is a huge big mess of nerves. It goes underneath the collarbone, in front of the shoulder joint, and then down into the arm. Okay, so when we have thoracic outlet syndrome, what has happened is the nerves are not being pinched up here, possibly by a disc or as it's exiting through the spinal column. The nerves are actually getting pinched more in this area, okay? And it's a positional symptom, okay? Which means that when our head is upright and our shoulders are back, there's a ton of room for these nerves to flow down into the arms. So we're not going to get any symptoms. You might have some pain in the neck still, but the pain into the hand goes away, all right? What will happen instead is someone with thoracic outlet syndrome, whether you're reading, that's a big one, or driving, anything that starts to disturb that posture, meaning our head comes forward like so, our shoulders roll like this, and especially when our arms come up. So I want you to think about when you're driving, or when you're reading a book, or maybe you're on your phone or something like that, it takes this area and it crunches it down, and we increase the likelihood that we pinch a nerve. And when we do that, we get symptoms down into our arms. Very commonly, it can be the entire hand or the entire forearm. That's another big way that we can kind of differentiate it from a pinched nerve coming through the neck. So if you notice that when you get symptoms in your hand or into your arms, and it is happening mostly with position, especially if you're driving or reading, and it's kind of like your whole arm, there's a good possibility it's thoracic outlet syndrome, and that's what we are hoping for, okay? Because the alternative is we have a pinched nerve in the neck. We can get a pinched nerve in the neck coming from maybe a disc herniation. It could also be caused by an arthritic spur. And in either case, it's not good. We might be able to help. We might be able to do a lot of things to alleviate some of those symptoms, but it's a little bit more serious, okay? And when that happens, you're not going to notice that, it's only worse made by this, right? A lot of times, it's kind of unbearable. It's hard to get into a comfortable position. Standing upright, with your shoulders back, it's not going to help. One of the worst ones is if you walk in and I notice that your hand is just sitting on top of your head, and this is the only, comfortable position you can get into, right? Or if you feel like you have to sleep in this position, it's the only way that you can get any sleep. Chances are we do have a pinched nerve coming from that neck, and at that point our treatment really kind of does change, and maybe we have to kind of co-manage with someone else as well, all right? So that's kind of the main differences between the thoracic outlet syndrome and a pinched nerve in the neck. The good news is that we see thoracic outlet syndrome a lot more often. So just because you have symptoms into your arm, into your hand, it does not mean that you have a disc herniation in your neck, and we're crossing our fingers that that's true, because we can fix you up, right? I hope that kind of alleviates some of the confusion between, do I have thoracic outlet syndrome? Do I have a pinched nerve? What's going on? Is this going to be easy? Is it going to be hard? If you have any further questions, always send them my way, and always remember to live with passion, not pain.